mineral water like Italy use different hydrotherapy options as a traditional medicine approach to cure the systemic manifestations of chronic diseases. However, neither packs with medicinal clays nor balneotherapy have been tested to cure the systemic manifestations of chronic obstructive pulmonary disease yet. So, the novelty of this trial was to look at both thermal intervention models as a passive warm-up routines and to compare their effects on endurance of respiratory muscles and cytokine IL-6 plasma concentration upon a moderate inspiratory resistive breathing challenge. And the rationale behind the study is that in normal subjects, inspiratory resistive breathing challenges affect the endurance of loaded respiratory muscles, which is considered to be an IL-6 dependent mechanism. The study is a randomized, parallel group, unblinded clinical trial in which 42 patients suffering from chronic obstructive pulmonary disease were allocated to receive the thermal treatment mud bath therapy model or comparator leisure thermal activity model. As far as the results are concerned, the cytokine IL-6 plasma levels circulating in blood after a moderate inspiratory resistive breathing challenge were not significantly different between the intervention groups, but ILB challenge increased cytokine IL-6 plasma levels systematically. Similarly, a treatment by time interaction effect existed in endurance time, which was significantly higher in MBT group. Central to the interpretation of this result is the observation that elongation in endurance time occurred while enduring against a submaximal inspiratory load. It suggests the occurrence of a training effect brought about by the metabolic adaptations in response to the thermal intervention model. And there is considerable interest regarding the mechanism which can promote the endurance of loaded respiratory muscles in chronic obstructive pulmonary disease. Eventually, the achievement of a training effect by using a passive warm-up routine is of vital importance in patients suffering from COPD. It could represent a smart strategy for treating the effects of deconditioning, which often limits the success of traditional rehabilitation.